I think the biggest thing that that the coping cart does is it gives kids a way to contribute to other kids.
First of all, the coping cart is awesome. It's the Apple iMac 3D. Then it has all these cool, stuff like the mouse and like the keyboard and all that stuff. It's really cool.
And one of the things I think that when you're stuck in the hospital or you've got a chronic concern that's not going to go away right away, one of the things that can empower you more than anything is to say, I've got this, I have to deal with it. I want to share with other people who have a similar problem.
My video will be about how I lost my kidney transplant due to getting bullied, then working up on another kidney transplant. Then only my grandmother and my mom died. So how I'm coping with these skills and, trying to be strong while I'm still sick as myself, because it's really hard losing like the people you most love and who took care of you for your whole life. So I have to be strong for them because I believe they're watching over me. They're just not here with me physically. So my videos will be good, I think.
The coping cart was an idea that I came up with in terms of working with children with medical problems who could benefit from the use of media. Often when kids are in the hospital for a lengthy hospital stay or repeatedly for medical problems, they really have a hard time coping with the fact that they're isolated from their peers, they're not in school, they're not doing normal things.
Ready, set, go!
And they're having to accommodate to their medical condition, their medical problems. I'm also a big fan of what we call social learning theory, and what that means is that we learn well from watching others, okay? And for young people, watching a peer, watching someone their age, someone with the same medical condition they have, can be a lot more powerful as a teaching tool than in having an adult talk to them or reading it or getting that information through some other mechanism.
My future is to have a kidney transplant, finish school, go to college, complete like 14 years of college, and then by 32 or 33 I should be a nephrologist and not a resident.
So the cart's a nice mobile way for us to do that and go from room to room. We tried to make our new cart a lot more interesting and a lot more portable. We also are able to have patients make their own videos using the cart. So we have a nice big computer with a screen on it and a camera, and they can make their own videos in their room at their own convenience, discussing their medical issues and again talking about how they cope with the different things they have to encounter having a chronic medical problem.
It really is helpful, so if you ever think you're in it alone, you can always look out the coping cart and know that you're not alone. It's many kids going through what you're going through too.